So if you need to fix your hair or your makeup, do so quickly because I'm going to take a picture from up here for my mom. It's not going on any social media because my mom has no idea about social media. But how do I find the slide? Sorry. But I told her I was speaking to the most beautiful audience in all of Toronto. And she said, I don't believe you. Take a picture. So smile, say hello to Kathy. Evidence. Okay, awesome. Thanks, folks. Me and my red pants are very glad to be here today. I'm going to be talking to you, that's for Trevor. I'm going to be talking to you about just some findings from, some preliminary findings from our iCruise study. Some of you may be very well aware of where we're at with it. Some of you are probably like, what? What is that? So I want to highlight that there's quite a number of the members of the research team here today, including Trevor Hart, Barry Adam, Dane Griffiths, Travis is here as well. I need to correct your name, and Daniel as well. So we have kind of a very actively engaged research team and staff. Liam is here as well from our cruise lab, and members of our advisory board. So what I wanted to do is just present to you today we decided to sort of jump into the data. We're actually still collecting data. But we decided to jump into the data to kind of have an opportunity to talk about some of the factors we were looking at in the data on minority stress and mental health outcomes. The overall study is really to look at how gay and bisexual men are using online tools, apps, and websites, and all the things that you put online to see whether or not it's whether or not they're engaging with these pieces of information and communities in a way that's kind of helping to address health and mental health. In order to be in the study, people had to identify as male, cis or trans is fine, had sex in the past year, or identify for very young guys to be romantically interested in other guys, or to identify as some of our sexual minority boxes that we check off as gay, bisexual, queer, two-spirit. They had to be at least 14 years of age and live, work, or visit Ontario pretty frequently. The only data collection I'm going to report on now is our baseline data collection, which we did over a 2-week period. And then people have also, we're still wrapping up the data collection of people giving us weekly diaries about where they've gone and what they've been doing over the last week online, and a follow-up, as well as a follow-up interview for some of our participants to get some nuanced data. We recruited people from August through just this past month. We're done with recruitment. And so what I'm talking about now is the analysis we've done on people who've completed both of the baseline questionnaires. So they've completed our baseline, and we have 860 guys in that sample. A little bit about the statistical methods, just in terms of trying to look at some of the associations between depression, which we measured through a standardized scale, the PHQ-10, and anxiety disorder, which is actually a self-report measure, not a standardized measure. And then we looked at some socio-demographic variables as well as mental health outcomes. So one of the scales we looked at is something called the Everyday Discrimination Scale. Some of you may have seen this. Have you experienced kind of a whole list of possible discriminatory acts or experiences in the course of your regular life? And then at the end of that, we asked people to check off, like, was it based on race? Was it based on sexual orientation or HIV status? I don't have all those details, but for people who reported everyday discrimination, what we did is we took the range of scores and we put them into quartiles. So the lowest 25%, the next 25%, the third 25%, and the top 25%. What you can see from this, does it look blue and orange to you? I don't know if it's orange or red. It's different. So, but anyway, what you can see from this is that there's sort of a linear process happening here, where you certainly can see that people who are reporting high levels of everyday discrimination about half of them are also experiencing depression and anxiety disorders. Same thing, we looked at social interaction anxiety and social phobia scales. So we know, as some of my amazing colleagues here have talked about, how we can isolate ourselves, become disconnected from others, which of course impacts our mental health. And so same thing here, to look at these scales about anxiety and self-report. And what we see is that people in the highest quartiles are experiencing the highest levels of depression and anxiety. We also decided to kind of modernize a lot of experiences of homophobia scales. Used to be things like, were you called a fag, were you beat up, things like that. But actually, the way it kind of works now is, do you see the hashtag no homo? Or are people saying, do you hear constantly around you, that's so gay, which is more considered a microaggression because it's not necessarily targeting you specifically, but it is, of course, sending a message about what it means to be gay. And so we have a microaggression scale. And again, what you can see is that the people who are reporting the highest levels of these kinds of microaggressions are also reporting the highest levels of depression and anxiety disorder. I don't have I do have the tables, but they're really ugly and overwhelming. But basically, for you to just see that what we're looking at, the higher levels of minority stress variables, so experiences of microaggression, everyday discrimination, and these kind of anxieties, what you'll see is that the youngest guys across the board are experiencing the highest levels of this. People who have a sexual orientation other than gay or bisexual, people who identify as being single or in polyamorous relationships as opposed to being coupled, which is an interesting link to Rahim's work, those with a lower education and lower income as well. Non-white racial identity had much higher rates of everyday discrimination, and unemployment was more associated with people who were reporting social interaction, anxiety, and phobias. So what we wanted to do was then see, okay, people who are experiencing this, are they going online and accessing the great work that many of you are doing and putting online, or that you're aware of, to get information about mental health and addiction? And what you can see, again, going back to that microaggression scale is, in the last 3 months we asked, have you gone online to get information about mental health and addiction? And so what you see is that, nearly 2/3 of the guys in the top levels of having experienced microaggression are actually engaging with online tools and information. So the what to do is very important, because what information are they actually interacting with? Like, is it actually helpful information? And who's putting that information out, and what are the messages are very important to consider. Also, in the last 3 months, have you gone online to get information on mental health and addiction for those based on your score related to social interaction anxiety or social phobia? And again, you can see nearly 3/4 of people experiencing anxiety are trying to access information online. Finally, the people who've reported everyday discrimination scale, and what we could see across the board is people who are not experiencing that very much are not using it as much or accessing online information. There's not a direct line across, but you can see that the numbers get high as there is an increase in experiences of everyday discrimination. So one of the things I've always wanted to know is whether or not the apps that people are using, that you have on your phone, many of you right now, that maybe you're looking at right now, see if I'm in there, say hi, send me a sup, that's cool. Anyone see Schitt's Creek this week? Golden moment about that. Okay, to see if people are interested in finding out about health information on the apps. Very initially, many of the app providers were very anti-public health or anti-including any kind of health information, until we started hammering them with numbers that say, these are your participants. Do you want them all to, experience depression, anxiety, loneliness, isolation, HIV, STI, no access to care or treatment? Is that really what you want? And basically, initially, they said, yeah, we don't care, unfortunately. In fact, many of them I had a little nickname for. Can I say it here? App holes. Yeah, basically. So, but in truth, what's happened is most of those apps have actually been trying to come around to think about how we can actually integrate things into the context of the work that they're doing. Some of them are amazingly better than others, and so that's one of the things. So one of the pieces of information I want to show to them is this. So, like if people are experiencing everyday discrimination, are they likely to try to access information and mental health substances within your app? And what you can see again here is that it's certainly particularly for mental health information that yes, people would like to have access to that information inside the app. The trope from the app is that we don't want to disrupt a user's experience. People come on, they want to hook up, they want to get laid, they want to have a good time, they don't want to hear about condoms or mental health, blah, 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 blah. But we're showing that actually maybe that's not true. And so many people use apps. I have, out of sheer boredom, loneliness, so there obviously are people engaging with this information online. So this is specific to people who've experienced the everyday discrimination scale, but the numbers are the same or similar. There's similar patterns in terms of people experiencing social interaction anxiety and other social phobias. And again, as well, I think the numbers are even a little higher for people who are experiencing microaggressions. So this is the kind of information I want to bring to some of my colleagues. There's an organization called Building Healthy Online Communities that goes through the California STD. I don't know their name. It's really long. It has California and STD in the title. Dan Wolfeiler, I probably should have put it up here, but I can find it for anybody who would like me to, that are trying to figure out ways to engage with building healthy online communities. And finally, just the last couple of slides are really about how often, how important is it for you to be able to access health resources on the internet. And particularly, we asked people who reported that they were experiencing high levels of anxiety. And you can see, again, a little bit of a linear climb in terms of it being very, very, very important. And lastly, one of the most important things is if you're on an app right now, good for you. I'd love a report. But if you're on an app right now, do you have privacy to have a conversation? Can you say, are you in a place where you can say, hey, where do I get tested? Or somebody came in my eye, am I going to get HIV? Or whatever it might be, right? Whatever the question is. So how often do you feel like you can have those conversations? And you can see that as people are dealing with depression, which could, of course, be a proxy on some level for social disconnection. It can also be a proxy for loneliness. That it's, people are less likely to feel like they can have those kinds of private conversations. So that's something that we'd have to figure out with app providers, like how do we ensure privacy? And of course, that's a whole thing about what they are trying to do. That is what I got to say for now. My email address is there in case anyone wants to reach out to me regarding anything. We're almost done with the data collection. We're still collecting the last round of diaries. We should be finishing over the next month or so, and then with the follow-up interviews for our participants. Some of you may be our participants. Thank you very much for your time and effort and attention to our work. So I'm glad to take any questions. Yes.